Now, ABC7 News at 4 on your side.
Coming up next on ABC7 News at 4, getting more perspective on former President Jimmy Carter's battle with cancer. We will be joined by a local oncologist to discuss the former president's decision to undergo radiation.
As we mentioned earlier in the newscast, former President Jimmy Carter says that his cancer spread to his brain, his liver, it's throughout his whole body, and right now he said he wants to undergo treatment. Joining
us now to talk about the president's diagnosis and what's next in Mr. Carter's battle is Dr. Michael Atkins. He's a clinical oncologist at MedStar Georgetown University Hospital. Welcome, Dr. Atkins.
Thank you very much. It's a pleasure to be here.
Thank you. We are talking about a 90-year-old patient who has been diagnosed with melanoma, but you're saying this kind of cancer is treatable?
Yeah, so 5 years ago, melanoma spread to distant parts of the body, was considered the cancer that gave cancer a bad name. Very few patients were successfully treated. Median survival was 6 to 9 months, and less than 10% of patients were alive at 2 years. But all that's changed in the last couple of years through the advent of research leading to new therapies. And there are several new therapies for advanced melanoma that even a 90-year-old could take that can be very successful. And we're now anticipating that with some of these therapies, that as many as half of patients with advanced melanoma can have their disease controlled.
That's incredible.
Yeah.
So when we also talk about the age of 90 and you talk about radiation, there's a lot of folks in our audience, they've either undergone cancer treatments or they know somebody who's gone through it. It can be very taxing. It can also be hard on the immune system, but you're saying because of the technology, that's even changed.
Yes, the radiation, especially for disease that spread to the brain, is now very precise. Machines such as a gamma knife or a cyber knife can come at the tumor from 1,000 different angles, intersecting just where the tumor cells are, and give very high doses just to the tumor and 1,000th of the dose to the rest of the brain.
Dr. Atkins, what you know about the president's situation, is that what they're going to do, is target radiation to certain parts of his body?
I think there would likely be targeting radiation to the lesions in the brain. And I don't know the specifics of his case, but when we treat patients with small brain metastases, we anticipate that 90% of those lesions will be eradicated.
And not knowing his exact, how far in advance the cancer is, what is the prognosis for a 90-year-old patient who has advanced stages of melanoma?
So I have several patients who are in their 80s and 90s who've received the new treatments, have had their disease respond, and are currently disease-free. So it's possible and may even be as likely as not that the disease could be controlled.
Dr. Atkins, before we go, is former President Carter coming to see you? I mean, will you be treating him?
I don't think so. I assume he's in Atlanta.
And Emory, yeah.
There are very good oncologists who are colleagues of mine who take care of melanoma at Emory who probably will be involved with his case.
Very good. Dr. Atkins from Georgetown Hospital, thanks so much for being with us.
Thank you for taking time. Appreciate it.
My pleasure.
Still ahead.